Hello, I'm Claire Lawlor, a partner specialising in occupational disease at BLM. Since March 2020, the UK public and private business sector have faced some significant challenges due to COVID-19 pandemic. As highlighted recently in the media, the lockdown rules in England have changed by the government at least 64 times since the start of the pandemic. We've been working with a number of key worker policyholders as they navigate their way through this. Keeping up with this changing landscape, coupled with staff and PPE shortages and the infectious nature of COVID-19, it's not surprising that at BLM we're now seeing and dealing with negligence claims being brought against employers in the public and private sector for contraction of COVID-19 in the workplace. It was initially expected that some high-value claims would flow from the small percentage of those patients who suffer serious complications and hospitalisation having contracted COVID-19. Further, that the majority of claims presented would be low-value claims for short periods of illness with a full recovery within a few weeks. That no longer appears to be the case. Concerns regarding long COVID started to emerge in October 2020 when research by King's College reported that patients were facing longer-term consequences of a COVID-19 infection. 1 in 10 were reporting wide, varied and persistent symptoms, including ongoing breathlessness, joint pain, cognitive problems and chronic fatigue, amongst others. The COVID cases presented are complex both on issues of negligence and medical causation, and claimants faced challenges proving that they contracted COVID-19 from exposures in the workplace. As expected, the majority of the initial cases presented have emerged from the care sector and key worker site outbreaks, which by virtue of the identified presence of COVID in the workplace eases the evidential burden upon a claimant to prove exposure that caused the infection came from the workplace and not outside of the workplace. The lack of testing in the first wave and depleting antibodies post-infection can result in claims being presented without a positive infection or antibody test to even prove a claimant has contracted COVID-19. Further, as a number of the most common long COVID symptoms, such as joint pain, chronic fatigue, are subjective to a claimant with no recognised objective test that can pinpoint the diagnosis, and insurers certainly face some significant challenges ahead. BLM has a significant wealth of experience in defending occupational disease claims and those involving chronic fatigue syndrome. CFS cases often present fraud concerns and there's no physical organic cause for symptomology. We work with a number of respected experts in a number of medical fields of expertise to determine the validity, diagnosis and treatment options available to improve prognosis to either successfully defend a case or minimise damages awarded. I hope you find the latest update on both national and international research and debate interesting in relation to this topic. Research into the diagnosis, symptomology and treatment continues, and the World Health Organization is hosting its first global seminar on long COVID on the 9th of February. Looking ahead, there is light at the end of the tunnel with the current vaccines being rolled out, and I invite you to our BLM COVID Hub, where we explore a large number of COVID issues affecting employees in the public and private sector, and most recently the debate concerning whether an employer can make COVID vaccinations mandatory for its staff.